Hi, I'm Dr. Brian Humphreys. Today we're at the Woodland Heights Sleep Lab, and we're going to be talking about some of the sleep disorders, particularly snoring and obstructive sleep apnea. Everybody knows what snoring means. Some people don't know what apnea means. Apnea comes from two Greek words meaning a, without, and pnea, coming from the same root as pneumatic or pneumonia, meaning air, without air. If you've ever been seen to not breathe at night, if your wife, spouse, bed partner has witnessed you to stop breathing in the middle of the night, you may have apnea. Apnea is a condition where a person stops breathing for at least 10 seconds at night. It's not normal to stop breathing for 10 seconds. Some people may even try to breathe but just can't get air in. When that occurs, sometimes our wife, our husband, will elbow us in the ribs. Your ribs can get to be hurting quite a bit too. Apnea is important because the brain and the heart, vital organs, do not tolerate having no air for prolonged periods of time. Slowly but surely the oxygen levels in the blood fall. The areas in the brain and the heart don't like that at all. Apnea will therefore produce low oxygen levels and will produce other serious consequences such as heart attack or stroke. People actually die in their sleep. It's a nice way to go if you're ready to check out. What are the signs and symptoms of sleep apnea? Most people with severe apnea have very loud snoring, heroic snoring as I call it. It can be heard rooms away, sometimes even from the backyard. People always have the reputation, especially men, for snoring. But even women have snoring, and as we age, the snoring mechanisms seem to slowly worsen. But there are other symptoms, including psychiatric and cardiac symptoms. Some of the psychiatric symptoms include being always tired despite a full night's sleep, being grumpy, being angry for no known reason. This can go on to inattention and difficulty working, especially with highly skilled and focusing tasks, depression, and even schizophrenia. Some coronary disorders or heart disorders are also well known to be accompanied by sleep apnea. These would include essential hypertension or high blood pressure, rhythm disorders such as rhythms that are too fast or too slow. Heart attacks are clearly associated with this condition, and even sudden death. So, what do we do if your doctor thinks you might have obstructive sleep apnea? Well, you would be referred to a sleep lab very similar to this one. The sleep lab is quite good. Despite all the monitors that are put on you, it looks like a hotel room. You have a comfortable bed, you have a nightstand and a telephone, you have a color television, and you have your own private bathroom. There is no other equipment in here other than sleep monitoring equipment and sleep treatment equipment. When you are getting your evaluation that night, the technician will put on several body monitors. Those include the degree of snoring that you're getting. They actually listen to that, what your heart rate is, your oxygen levels, your breathing rate, electrical activity in the brain, electrical activity from the heart, leg motions, and eye motions. There's a lot of wires involved, and that really is about the only thing that you'll notice. If you have an emergency, an attendant is available. During the sleep study, if you are found to have evidence of sleep apnea, the technician may actually do a second part of the study, which is a breathing unit. A mask will be applied to the face, and this is sterile, that will help increase pressure into the airway, the nose and the mouth during sleep. The mask may be a large one like this, it may be a little bit smaller like this, or it may actually be what we call nasal pillows. These sterile pillows are inserted into the nose and gently blow air in to help the person breathe at night. This titration study will help determine whether this unit, this breathing unit, will be valuable in your treatment. If you've indeed been found to have obstructive apnea, there will be a judgment made as to how serious your apnea is, all the way from mild to severe. Depending on the severity, medical treatments for intervention may indeed be necessary. The treatments for sleep apnea can be divided into two major categories: breathing devices for use when you're asleep, and surgery. The surgery for sleep apnea can involve any part of the upper airway. 30 years ago, the only treatment known was tracheostomy. Today we have other treatments of the throat, of the nose, and of the base of tongue that help significantly. Among the surgical options are small procedures done in the throat. These procedures shorten the palate and allow airflow through the palate and oropharynx. Some of these procedures are small enough to be done in the office. For more severe apnea and obstructive cases, the procedure may actually involve more work at the back of the throat. The airflow is then improved. The body does not fight for sleep at night, for air. Sleep patterns improve, and a cure is effected. These surgeries require a mutual decision by your surgeon and the patient. The breathing units are always used first. We do that because not everyone wants to jump to surgery. If the breathing unit does not work, then we can consider the surgical options. Some of the breathing units we've already seen, and they can completely cover the nose and mouth. They're strapped to the head. They can cover only the mouth or the nose, and the degree of comfort is important. Whatever the person's complaint that he can't wear a CPAP unit can be addressed specifically. We can always, just about always, fit anybody with an appropriate unit that's comfortable and pleasant. This is the base device for a BiPAP breathing unit. BiPAP means 2 levels of positive airway pressure. CPAP means continuous positive airway pressure. One of these devices will be right for you. If your doctor has recommended a breathing unit for treatment, it is prescribed medically, and he must prescribe that for you. The pressures are very specific to treat your condition. Usually we ask the person to try the breathing device for at least a month. Then we reevaluate the condition. You wouldn't believe how you feel like $1,000,000 after your first good night's sleep.